If you're a regular viewer of Post Time, you know that we love having Dr. Christopher Baldt on the show, giving us important information about the health of our equine athletes. And today, we'll be learning about a condition called laminitis. Take it away, Dr. Baldt. So what is laminitis in horses?
Laminitis is actually an inflammatory condition that occurs in a piece of the connective tissue called lamina. It's a highly vascularized structure that connects the hoof to the coffin bone.
What are some signs that your horse may have laminitis?
There's a couple things you'll notice when a horse has laminitis. One, you'll see them standing in an awkward position where they rock their weight backwards and they take the pressure off their hooves or their toes. You might also see them having issues with walking, or their gait could be changed. They have sensitivity in their feet. Over time, they can actually develop lameness, and if it gets really bad, it can be fatal. The most important thing, you always want to get a veterinarian involved. If you can't quite figure out why your horse is acting differently or performing differently, but a layperson can observe the horse, see how it walks. You can also get a hoof tester, which is one most of us who've been around a barn have seen, where they actually press on the hoof and look for tender points, which would be much different than an abscess. You could also check for the digital pulses, because a horse with laminitis is going to have altered blood flow. And then, so mostly you're looking for pain, dysfunction, and altered blood flow.
What are a couple factors that contribute to laminitis?
Laminitis has two main factors. One is going to be some sort of trauma. We know that during the racing, we're racing on hard surfaces, so sometimes the pounding of the horse's hoof can actually begin to create inflammation in the lamina, and as a result develop laminitis. There's another type of laminitis that occurs from metabolic problems, most likely seen in obese horses, horses that have like Cushing's or PPID, which is a pancreatic problem. Also those who use a lot of steroids or glucocorticoids, and there's a couple other metabolic problems that cause laminitis. Some contributing factors to laminitis also include rich grass fields, poor diet, rich in starch and sugars and things like that, overuse of treats, but maintaining the proper barn environment, the proper diet, nutrition, and a good medical checkup, and you should be able to keep this under control.
Thank you again, Dr. Baldt, for coming on our show and sharing important information on how we can continue to keep our horses happy and healthy. We want to remind our viewers that you can see so many of Dr. Baldt's segments on our YouTube channel at youtube.com/Posttime Show. By the way, if you would like to contact Dr. Baldt, just log on to his website at drbaldt.com.